It is my distinct pleasure to introduce our esteemed speaker, Mrs. Tejiri Agenmonmen. She was born and raised in Nigeria and has built an impressive career in the field of computer science and information technology. She completed her undergraduate degree in computer science from medicine Idaho University in 2006, and she served his country through the National Youth Service Corps from March 2007 to February 2008. Her thirst for knowledge led her to actually further her education with an MSc in computer science in 2019, and later a distinction in MSc Management of Information Systems and Technology from Coventry University in 2023. With over a decade of experience, she has worked in both the public and private sectors, specializing in telecommunications and education. Her work is characterized by a collaborative approach, working closely with the stakeholders at every level. Currently, she is residing in Coventry, United Kingdom, and her main priorities include information technology management using digital transformation strategies, developing her data analytics abilities, and exploring cutting-edge artificial intelligence solutions. Please join me in extending a warm welcome to our distinguished speaker.
Thank you very much. Thank you very much for the introduction. Hi, my name is Tejiri Agenmonmen, and I'm very pleased to be one of the participants of this conference. You have already done the introduction, so I'll just go straight into the presentation. But before I start, the main reason why I conducted this research was mainly because of course, you all know the ailment stroke and the impact it has on the body. So I felt, for one, early detection would really help improve stroke and also try to manage stroke on its as an ailment. So I'll share my screen now. Okay. Can you all see my screen?
Yes, we can see your screen.
All right, so I'm talking on early diagnosis and management of stroke. So this is basically a research work, so I'll really need inputs from professionals who are already in AI, using AI for different things in healthcare, IT, whichever aspects. Your contribution is really needed, so feedback will really help, go a long way. So artificial intelligence, hello, can you see my screen?
Yes, we can see your screen.
All right, so an artificial intelligence, which is known as AI, is a system, and is an expert system which is designed to replicate the process applied to make decisions just like that of a human expert. And this is according to Stuart Russell and Peter. And an expert system uses algorithms and sets of rules to analyze data.
Hello, Mrs. Tejiri. Sorry to interrupt you. Click on slideshow, okay? Slideshow, the fourth one.
Okay, sorry.
No, go down.
Now
there is a zoom one.
Yeah. Okay. Can you see the screen now?
Yeah, it's okay now.
All right, so I'm talking about expert system for early diagnosis and management of stroke. So an artificial intelligence system called an expert system is designed to replicate the processes applied to take or make decisions just like that of a human expert. And according to Sigolis in 2021, medical personnel will be able to immediately identify possible stroke cases by using an expert system to analyze a variety of data from people who attend hospitals, including medical history, symptoms, results of diagnostic tests, which points to initial detection of stroke. So what is stroke, for instance? A stroke is a medical disorder that develops when there is a blockage or vessel rupture that interrupts the blood flow to the brain. This disruption may also result in the death or destruction of brain cells. And according to Kim in 2022, there are different kinds of strokes, which we have the ischemic stroke and the hemorrhagic stroke. So in all, the concept of expert system, which is the artificial intelligence system, is created to mimic the judgment made by people who are experts in a certain field, utilizing sets of rules and algorithms to analyze data and make informed judgment. So the focus in this whole research work was to develop an expert system that is trustworthy, and also it is web-based, is a web-based application to assist medical practitioners in observing different stroke types, thereby improving patient outcome. So the background, one area of computer science we all know is AI, which a lot of people is talking about in this conference. It entails the making of computing programs to carry out tasks that would otherwise require the intelligence of a human. Intelligence is defined as one's ability to make a choice of environment, adapt to it, and also influence learning through experience. And a wider range of tasks, from filtering email spams to delivering takeaways to solving more complex issues, are being taken on by artificial intelligence, the algorithm involved in it also, and also the patterns. This is because modern medicine relies increasingly on data collected through imaging, historical, biochemical, or other studies. Many of the management routes used today are there to the rigid semi-algorithmic protocols. So this figure 1 shows an artificial intelligence, what it entails. We have the symbolic AI, which encompasses the expert system. We have the machine learning, which encompasses the deep learning. And also we can see the display of an artificial intelligence system framework. We see that it has information has to be passed into this system. The system needs to be trained, and of course, before the artificial intelligence system will be able, the expert system will be able to perform the way we want. So we need to talk about expert system and also expert artificial intelligence system. So with the development of expert system, the concept of expert system has evolved. It is a system that has a base for knowledge, which means that it has access to and is continuously accumulating all the information required to assess and solve an unusual situation. So the expert system for early diagnosis of stroke is said to be artificially intelligent because it will be a machine that is able to mimic human intelligence. And this machine doesn't just mimic human intelligence. So what it does is that it has to be trained. And for it to be trained, what I used, because it's a web-based machine, it was trained using secondary data. And as we go on this presentation, you notice that the secondary data was gotten from Kaggle. So this secondary data gave us the different things we needed to use to train the system, so that when the system is used by maybe the medical professional or maybe the patient, they will be able to realize that, oh, the system is detecting their signs and symptoms presented. So the medical expert system were developed to help doctors and patients diagnose and treat illnesses. They can also be used to inform and notify doctors and patients of potential health problems. Due to their constant ability to help their users, they may also present an improvement in life quality. So the goal of combining healthcare with digital technology is to increase safety, its effects, and reliability of medical treatment. Given this, it is necessary to build an appropriate model for the medical expert systems to manage knowledge that may result due to its ambiguity. As the last factor, the concept of trust must be taken into account when creating a medical expert system. Trust in the healthcare industry may be viewed as a human interaction with cognitive component as well as the effectiveness of a patient's treatment, a doctor's diagnosis, and their communication. We already talked about what stroke is, and this study was inspired by a constant increase in the number of stroke cases. And I went back to my home country, Nigeria, to work on this. As in I reached out to medical professionals. I wasn't there physically though, but I reached out to medical professionals, and through questionnaires and also interviews, resulting to creating of this project. And it's increasingly apparent to everyone because of the way stroke is, we needed to look at it and look at how it could be improved. Sorry, excuse me. So stroke is instigated by some factors like smoking, cigarettes, high blood pressure, a history of stroke as regards to family, high cholesterol, high blood pressure, obesity, being overweight, and cardiovascular disease condition all affect and disturb the brain and damage some parts of the body. So the stroke sign and symbol vary from motionlessness, and the affected part of the body could be poor speech recognition, loss of balance in the affected body portion. So we have different stroke cases. We have the ischemic stroke. This is the most most popular type of stroke. About an average of 85% of stroke cases in the United Kingdom are ischemic, and that is reported by a blog on Stroke Association. We also have the transient ischemic stroke. We have hemorrhagic stroke. The hemorrhagic stroke is the form of stroke that occurs when there is bleeding inside the brain. It frequently results from a bloody artery, a blood in the artery within or on the surface of the brain rupturing or leaking. And under the hemorrhagic stroke, we have the intracerebral hemorrhagic stroke, and we have the subarachnoid hemorrhagic stroke. So early diagnosis of stroke, this is the research gap I got. An investigation on the usage of an expert system for stroke diagnosis at a tertiary institution in Nigeria was understudied. According to the work, the author noted that the expert system accurately diagnoses stroke in 91% of instances, and the researcher resolved that the method will be useful for Nigeria's early stroke diagnosis. This research contributes valuable evidence supporting the potential use of expert systems in Nigeria. So overall, the mentioned review studies collectively highlight the significant potential of expert system in improving stroke diagnosis through enhanced speed and accuracy. They also provide evidence of the effectiveness of expert systems in specific healthcare contexts, such as tertiary hospitals. These findings supported the ongoing efforts of to integrate AI and expert systems into healthcare practices and can inform further research and development in the field of stroke. However, it is essential to acknowledge that there may be limitations and challenges in the implementation and adoption of these systems, including the need for robust validation, data privacy consideration, and resource constraints. Further research and collaborative effort between medical professionals and AI experts will be necessary to address these challenges and fully realize the potential benefits of expert systems in stroke diagnosis and patient care. So before now, we had early systems. We had systems for early diagnosis of stroke. The systems for early stroke management, we had the stroke units, we had the public awareness campaign, training and education, stroke research, collaboration, data collection, and also registries. So the effect on healthcare systems is that the stroke experts had financial constraints on healthcare systems as a result of the expenses linked to immediate medical interventions. This results in a rise in the number of patients being admitted to hospital, visiting outpatient clinic, and using healthcare services. The enduring impairments arising from stroke necessitate continuous medical attention, rehabilitation services, and assistance, placing an additional burden on healthcare system. So obstacles in early detection and treatment, we had different obstacles. The early detection of stroke is also essential for optimal treatment and improved results. Nevertheless, appropriately diagnosing stroke in its initial stages might provide a challenge. Access to specialized healthcare institutions, especially in rural or underserved locations, may be restricted. That is according to this research work, and resulting in delays in receiving necessary treatment. So healthcare providers may have inadequate training or expertise in identifying the indication and manifestations of stroke, leading to instances when diagnosis is overlooked or delayed. So the proposed solution for this whole thing, that's the web-based, is a web-based expert AI system for stroke diagnosis and management. And in designing the stroke artificial intelligence expert system, the web-based interface was decided upon rather than the Windows desktop interface. And the primary reason was to create an application that can easily be accessed by all users. So we had the desktop application have the drawbacks of requiring users to have a computer system and running Windows. By building the application to run on the web, anyone with a phone can access it through the internet. So looking at the proposed system, you have when you log on through the home page, you'll be able to see diagnosis after putting on the signs and symptoms the patient is facing, and then it will get you to the diagnosis result, and you see the general information. So the descriptions of the system's features and capabilities in information and communication technology, particularly in AI and machine learning, are already playing an important role in disease prediction. The expert AI system uses case diagram shown as you can see, and it's simple. It's a user-friendly system so that patients can easily make use of it instead of making it complicated. So the implementation, we have overview of the technology used. Earlier, I said I combined both the primary data and secondary data. So this is actually the secondary data, the stroke data set gotten from Cargo. The back end of the application was implemented using PHP language, hosted on Apache web server with support from MySQL database server and other data format. The Apache web server was used because it offers a versatile closing environment that enables a web-based application to function as necessary. And the PHP is extremely popular and supports various data formats such as JSONs and CVS. So details on the web-based domain hosting for accessibility, this is the backend. The healthcare data set, the stroke data file, which is a CVS file, was easily analyzed and processed using PHP. This is an exceptionally large data set of live cases. It was over 5,000 cases in terms of gender. We had 2,994 cases as female, and 2,116 cases as male, and we have every other cases there. Then the PHP has a large library of functions for handling simple advanced data structures such as the arrays and lists, and also the PHP works seamlessly for web input. So the front end has the HTML and then the cascading style sheets. Both the front end and back end were hosted on the web server under a domain name from where they are served as various users of them. Where they are served to various users of the application. It was worth mentioning various images, pictures were used to quickly enhance the appeal of the application. So this is a system functionality. In testing the system, we had to check if the application window is being executed. And this actually, figure 8, shows the landing page. That has the link there. So if you go on through the link, you'll be able to see the system. We also have we checked whether the diagnosis, when you put in your stroke signs and symptoms, if it works. And there were assumptions, there were procedures, and the expected outcome is patient diagnosis wizard open where various attributes of stroke diagnosis are given. So we had the actual results and the status as pass. And in testing the stroke AI system, end users were involved and feedback gotten from them was used to refine the system accordingly. So benefits and potential impact of expert systems on patient outcome in healthcare efficiency. We have the precise diagnosis when you're able to use the system well, feed it well with the stroke signs and symptoms, it's going to give you the precise diagnosis. And it helps with early detection, which is the main goal in this research. And also differential diagnosis gives you different kinds of stroke diagnosis. Individualized care tells you what to do when stroke signs and symptoms are fed into the system. And it gives you a decision support system. It's very efficient and it gives room for continuous learning. So in conclusion, recommendation for this project would be that the expert system would be fully implemented in hospitals back home in my country, Nigeria, and should be used by stroke experts and clinicians. The current system built is web-based, so the expert system may be seamlessly integrated with current healthcare applications through collaboration with mobile health app developers, reaching a larger patient and healthcare provider audience. Management of the Nigerian hospital implementing the use of expert systems should essentially follow current standard guidelines and always observe patient privacy of data. In building the expert system, several factors were incorporated into the system for it to be effective. However, this can serve as a future work to be done, which make stroke detection result more robust and accurate. And this further research is that participants from survey requested that microimaging systems like the CT scan and MRI should be embedded in the AI system. To improve access to specialized care, the expert system can be incorporated into telemedicine platform to provide remote consultation and assessment of stroke patients in underserved or remote areas. Thank you.
Thank you, Mrs. Tejiri, Agenmonmen. That's a nice presentation. We have got 5 minutes for question and answer, if anybody have.
Hi, Tejiri. Tejiri?
I'm trying to stop this.
You're hearing me?
Yeah, I can hear you. I'm just trying to stop the presentation. I can't seem to find
the button in the middle up that says
what?
Stop screen share.
What I can see is new share, pause. It's quite different. Okay. Okay, I've seen it. Thank you.
Okay. I just want to say you can actually reach out to me as well. I've actually worked in low-income houses for doing studies on diabetes and hyperlipidemia. You could also do some research. You could find out because currently the University of Dundee and at the NHS in the UK, they are doing studies where they're actually looking at computer vision to try, based on all the scans that they had before, to detect dementia. So you could try and
wow.
see, you could probably learn from some of those things as well. My question relates to, and if you're having issues with that, you could probably reach out as well. Usually when it comes to a lot of these types of modeling, left censoring, so not knowing the patient's thing beforehand is an issue. So you have to be a little bit careful when you're looking at modeling approaches. So feel free to reach out to be able to reach out to handle things like that. And my question is, have you done any sort of thing in terms of, or is it not to do like you creating like a confusion matrix, or if you're using any sort of survivor models to try and predict your modeling approaches in terms of determining how good your system is working?
Okay, initially, before I did the expert system for management of stroke, early detection and management, I did developing an expert system for, as in I just talked about expert systems and I used fuzzy logic to analyze it. Yeah, so that was what I did earlier before I now did this current one.
Okay, so if you need help with debunking the maths to incorporate like Cox proportionality modeling, which is what we use a lot in trying to look at survivor models, or even if it is you want to use a normal another completely non-parametric using Nelson Allen tests to go about in terms of survival, because things like histology and looking at, well, I know they tend to look at the CK enzyme sometimes when you're dealing with stroke patients, but those things are not always, if it's updated onto the system, to use that kind of thing. So in terms of using the maths, feel free to reach out.
No worries. Thank you very much, Chad.
All right, bye.
Yeah, we have Sebastian raising up his hand.
Hi, Tejiri. Yeah, it's I love the research that you've done, and again,
thank you very much.
Dr. Chad stole that information. So when I saw stole that question from my memory at the moment, when I saw the accuracy, that's impressive. But I was about to ask, because most times, or the factors that you used there in building that model are highly prone to false positive and false negative. And that was why I said Dr. Chad stole that. So I'm not going to ask that question. But what I'm going to say is, it's very good for you to see it from a bigger perspective, a broader perspective. Now, I mean, we need to, and you need to also focus your solution towards clinical sector. When you've done that, then you can come back to what Professor Dana talked about acupuncture theories, where she worked on acupuncture, because that is what is currently going on. You don't expect someone to go to an X-ray to scan first before you then plug it into the system. So you need to, like in Chinese acupuncture system, at the left palm, I don't know how theory Professor Dana can speak more on that. They said all the diseases are on the left palm. So there are different parts on the left palm where they can dictate that. And that is true, because I've done that experiment using traditional medicine in that old sentence. So that's just my feedback on that. Thank you.
Thank you very much for the feedback. I appreciate it.